Good morning, and thanks to the VRMA for having me. Thanks to you all for being here. I am from Oregon State, and I am a clinician. My main goals are to find allogenic MSC that I can use to administer to patients that will have minimal alloimmune reactions. I'm doing this by both manipulating the cells, but also manipulating the media that those cells are in. I administer these cells into soft tissue lesions. I am a fan of repeat injections, repeat treatments when we need them. So having a cell that I can administer and administer again without having an alloimmune response or an antibody response in general is important for me. I use these cells both in the soft tissues and intra-articularly. Obviously, in these osteoarthritis cases, this is going to be an ongoing problem, so these horses need repeat therapies. So finding something that we can use repeatedly to have good cell viability after repeat administrations is a topic that I am interested in. Now, I'm going to be primarily talking about the media side of this, and our main problem is that we have been commonly using FBS, the xenogenic media, and we found that this has caused an antibody response in the horse, which causes MSC cell death after administration. There are a lot of people that have come before me and looked at a similar topic, and I appreciate all of their work done, but we still haven't really gotten a consensus of what type of media is going to be best to use to grow these cells, especially in those final days of cell proliferation before we administer those to the horses. What we have found is that if we remove the FBS 48 hours before we administer the cell, we remove about 95% of that alloimmunogenic protein. So we know we need at least 48 hours of this. My goal would be completely remove this alloimmunogenic protein, so I think that we need to go for longer than the 48 hours. So previous studies have shown that we've got this increased inflammation when the cells are cultured in the xenogenic media as compared to the autologous media. We see this in clinical signs with lameness, effusion, cytologically with increased white blood cells. We also see increased inflammation when repeat injection of these MSCs grown in the xenogenic media. So this xenogenic media is really a problem. Unfortunately, it has been such a great mediator to cause good proliferation in these cells and great viability that it's hard to find something that's going to be equally beneficial in the proliferation scores. We also know that there's these anti-bovine antibodies that are present in most horses, likely due to our vaccinations. So that these cells that do have the bovine proteins in them are rapidly attacked. We can see this graph showing in the blue, these are going to be the autologous serum treated cells. In the red are the xenogenic treated cells, and we see much lower recovery of our MSCs that are treated with the xenogenic media as compared to the blue, where we have very good recovery of MSCs from the joint environment. Additionally, there's been a lot of different medias that have been looked at. What we can replace FBS with. We've used bone marrow supernatant. We've also used plasma lysate. We've used serum, and these are very good studies. The plasma lysate has shown good proliferation scores when comparing that with the bone marrow, the FBS. These were very young horses, though, which is not the population of animals that I treat. I see a lot of middle-aged and older animals that I need to use autologous cells on, so I wanted to do a study where we had a wide range of horse ages to look at how their MSCs respond to different medias. Additionally, it would be great to use the serum-free media that they use over in the human side, but we've seen different phenotypes result from the use of this serum-free media. The CD90 was greatly reduced. The expression of this was greatly reduced when we used our serum-free media, so we've gone away from that on the equine side. So here is the study that we performed. We had 3 horses of varying ages. There was a 2-year-old, a 7-year-old, and a 17-year-old. We took autologous serum from them, and we took bone marrow derived MSCs. We expanded those MSCs over 4 passages. So these were kind of middle-aged MSCs. And we also used Xenogeneic serum. That's going to be our classic FBS. We also use commercial allogeneic serum, and this is the Thermo Fisher variety that we can get on the equine side. It's a pooled equine serum. Very easy to use, right off the shelf, ready to go. Would love to have something simple and straightforward like that would work. But unfortunately, this is our cell proliferation data. So as you can see, far over on your left is the Xenogeneic is the FBS, so that was our cell proliferation after the 7 days in culture. So we saw significant differences in the treatment of the cells with 7 days of the commercial allogeneic, either 10% or 20%. We tried a bit of commonly we use 10% of the serum for our medias, but we tried to go a bit higher with the commercial to see if we could get any benefit to that. There was a small benefit in cell proliferation numbers, but really nothing that was significant. So both of those were significantly lower, gave us significantly lower cell numbers after the 7 days. Meanwhile, our autologous serum, and this is autologous non-heat inactivated serum, those that did allow for proliferation, not nearly as much as the FBS, but they did allow for adequate proliferation. Then far to the right, we did the staged serum administration, where for the first 3 days, we gave 5% FBS and 5% of the autologous serum, and then for the final 4 days, we used just autologous serum. And this gave us fairly good proliferation as well, though not as much proliferation as the Xenogeneic media. Now, if we look into this a little bit harder, where we start to look at horse-by-horse responses, we get the problem that I see clinically when I am treating my older horses, where we have fairly poor proliferation of those MSCs in anything but the Xenogeneic media. So this first horse is the 17-year-old, the green horse is the 17-year-old. Decent proliferation with the FBS, but fairly poor proliferation even with her own autologous serum, while we got fairly good proliferation with the younger horses with the autologous serum. So there is very much a horse-by-horse variation in the proliferation of these cells. And this is going to be limiting for us to be able to get the cell numbers that we need to get, and while still decreasing that alloimmune response that we get to the FBS. If we look at viability scores, it's very similar, where that commercial allogenic serum was not helpful for us. So it caused poor viability in the cells, while there was a very good viability for the rest of the different categories. CD44 expression on flow cytometry was fairly high for all groups. Those start at 86% and go up from there. CD90 was very similar, where they all expressed fairly highly, very highly of the CD90 marker. MHC1 was very high, MHC2 was very low, and our CD45, which is our negative marker, that was low in all of the populations as well. We are almost done with our trilineage data, but we do not have the chondrogenic data back yet. The osteogenic data was positive, where we saw a differentiation for the autologous serum and for the adipogenic serum, though our chondrogenics are still with histopathology. So we looked just briefly into why there were those variations in response. Does it have something to do with the total protein? And what we found was the FBS had a protein score around between 3 and 4. The commercial allogenic, the total protein in that was very high right off the bat, but then we filtered that and we saw a dramatic decrease in the protein. And we use the 22 micron filters for all of our serum, so they are all filtered. So it seems like there's some sort of fairly large protein in that commercial, or whether it's through the processing, the process of it, but something a bit different from our other serums was going on with the commercial allogenic, and our autologous filtered was very similar to our autologous unfiltered. We did try to do PRP lysate in the study, and we will continue to do PRP lysate in the study. But if you see from this, the middle well is FBS containing media. The left side is PRP poor lysate media, and on the right is PRP rich media. You can see that both the poor and the rich wanted to form gels in our population, and honestly, this was only on one of the horses, so it seems like it was a little bit cell-specific. The other 2 horses had normal liquid media, while we were getting the gel formation in the PRP lysates with the one horse. So we still have some tweaking to do with the PRP lysate to be able to get cell counts from that one. But I do see that potentially being a problem with PRP. Our horse serums really do like to form these fibrin gels if you don't allow them to sit at room temperature for an extended period of time. So in conclusion, our allogenic commercial is not the way to go. Our older horses were definitely more affected by our serum choices. We liked autologous 10% serum for most of our horses. It gave us appropriate proliferation, and it decreases the chance of alloimmunogenicity to a high degree. I think after 7 days of using the serum, we're going to have very low alloimmune responses. But the stage serum may be better for our older population. It seems like they do not proliferate as well with their own autologous media. So using the stage where we used 5% of the FBS, 5% of the autologous serum, followed by the autologous serum for another 4 days, will be the way to go for those guys. And future directions is to use that PRP lysate and then to maybe consider increasing the amount of serum we have in our medias. That might be another way to get us some increased proliferation. And I just want to thank my team back at Oregon State, and I would love to hear any questions.
Thank you so much.
Thank you.
We have time for 1 or 2 questions.
Lacey, very interesting work. I'm all about immuno aspects of our MSCs, which were conveniently deemed immunoprivileged, which I completely disagree. I wanted to ask you if just simply washing the cells from FBS would help and then administer them, because we use that technique for cell viability assays that really dislike any protein around the cell. And also, why do you think it's just adsorbance of FBS to the cells that provides them with that immunogenicity we don't want, or they actually phagocytose the protein? What do you think?
That is a really good question, both of those. We do wash all of the cells twice with FBS before all of these studies. So I don't think having it, it's not going to be in the media around the cell. It's going to be intracellular, and whether it's by, phagocytosis, I honestly, I don't know, but a great question.
I was just wondering if you looked for whether the cells at the end of this actually had bovine proteins expressed on their surface. Because I know that Ashley Watts' lab took that approach, and I was just curious about
Indeed.
that.
No, we haven't gone as far as to do that. And I think that will be important to see what the time frame is for getting rid of those proteins. The assay where they were able to bind FITC to the FVS is something that we have started to think about replicating. It is difficult because our immunofluorescence molecules disappear after 48 hours. The ones that will last a little bit longer will not have as good viability as, potentially may affect the viability of the cells themselves. I understand that you dialyze the FITC, the FBS itself with the, right, and then administer it to the cells. So then you only have so long where the FITC is fluorescent to be able to assess. So to be able to go to 7 days with FITC is just not a possibility. We would need to use a different fluorochrome that would last for longer. So yes, I think it would be a great project, definitely.
Thank you so much.